Hello and welcome back to GP Video Podcast by Nadia. Tonight we are again talking about type 2 diabetes mellitus, which is one of the most common chronic conditions, and sometimes it is also called as, unfortunately, mother of all the diseases. So awareness about type 2 diabetes mellitus is very necessary. What is type 2 diabetes mellitus? Type 2 diabetes mellitus is a condition which is characterized by increased blood sugar levels because the body is not able to respond to amounts of insulin, normal amounts of insulin which are being produced by the pancreas. So what does pancreas do? Poor pancreas produces more and more insulin, but because body is not able to respond efficiently to that insulin, therefore the amounts of blood sugar levels remain high, and there comes a time when the pancreas also stops working nicely and the amounts of insulin get reduced, and once comes a stage where the type 2 diabetics are also put, apart from oral medications, on insulin. So type 2 diabetes is a chronic condition, is not a very good condition, and there are some facts that I would like to discuss today with you guys. So number one fact, it is the most common type of diabetes. Did you know that some 90 to 95% of people with diabetes have type 2? If you are of African, Hispanic, South Asian or Aboriginal descent, you are also more prone to developing type 2 diabetes compared to other ethnicities. So again, which ethnicities? African, Hispanic, South Asian or Aboriginal descent. You are more prone, including me, are more prone to develop type 2 diabetes. Number two fact. Being overweight increases your risk of type 2 diabetes. Research shows that tongue twister, that if you are obese, your chance of developing type 2 diabetes is 80 times greater than those of people whose body mass index is within a normal range. The extra pounds around our middles are especially worrisome because abdominal fat disrupts the responsiveness of cells to insulin. So what is number two fact? Being overweight increases your risk of type 2 diabetes. Interestingly, type 2 diabetes is strongly related to family and genetic factors. So if it's in your family, you are more prone to get type 2 diabetes. So it is the non-modifiable risk factor. But we do have strongly related modifiable risk factors as well. One of them, which is being overweight, which we can control. We cannot do anything about the family factors, family risk factors or genetic risk factors, which are non-modifiable risk factors, but we can do everything about the modifiable risk factors. Out of them, one of them, which is obesity. Number three fact. You can develop diabetes at any age. Yes, you can develop type 2 diabetes as a child, teen or adult. No more myth that type 2 diabetes is only developed when somebody is in their middle age or later age. No, you can develop type 2 diabetes as a child, teen or adult. But this type of diabetes is, yes, most common in middle-aged and older people. Having a family member with the disease also increases your chances of developing type 2 diabetes, which I again said is the non-modifiable risk factor. Fact number four. Type 2 diabetes often represents without symptoms. About one third of people with diabetes don't know they have type 2 diabetes because often this kind of diabetes has no symptoms, which is very much opposite to type 1 diabetes. Number five. Diabetes is a risk factor for many diseases and health complications. It is often termed as mother of all diseases. The reality is that unmanaged diabetes has been linked to a host of health-related issues such as infections, kidney disease, depression, sleep apnea, Alzheimer's disease, and even some forms of cancer. It is important to work with your healthcare team to ensure your diabetes is well managed and speak to your healthcare provider if you have any concerns. So today we stop at 5 facts. Number one fact. It is the most common type of diabetes. Which one? Type 2 diabetes. Being overweight increases your risk of type 2 diabetes. You can develop diabetes type 2 at any age. Type 2 diabetes often presents without symptoms. Diabetes type 2 is a risk factor for many diseases and health complications. Again, it is related to modifiable and non-modifiable risk factors. Modifiable risk factors include obesity, physical activity, and many more that we will talk about. And non-modifiable risk factors include family and genetics, like family history and all, which we cannot do much about, but we can do a lot about the modifiable risk factors. And once we are diagnosed, unfortunately, with type 2 diabetes, we can still do a very good control with the medication and lifestyle modification. Catch you tomorrow.